Hi everybody, welcome back to the channel. I'm Dr. Justin Feldman from Feldman Physical Therapy and Performance, and this is Toby. And I'm guessing if you've clicked on this video and you're watching this video, then you have some sort of surgical procedure or something scheduled, or maybe a family member does, and you're trying to figure out when you need to schedule your post-operative PT, and that's what we're going to accomplish here in this video. So it's important to understand why we really want to emphasize getting early post-operative PT. And a lot of it depends on your specific procedure, but there's a couple things that are really key. One is the ability to prevent or reduce any inflammation. The other is getting some early muscle activity to prevent any atrophy or weakness. And then the other one, which is probably most important to you, is pain control, trying to help you feel as good as possible depending upon the procedure that you had. A lot of times, the earlier we can get you started in your post-op PT, the better the whole overall experience will be for you, and also the faster it will be. And so early post-operative care is really associated with a better and a quicker outcome overall. Now, unfortunately, like a lot of the rest of the healthcare system, we end up booking out a little bit. And so I always hate it when we get a phone call from someone that says, hey, I just, saw my doctor for a post-operative visit, or even worse, I just got discharged from this procedure and the doctor wants me to start PT tomorrow. And the doctors, they're great at emphasizing how important it is that you start right away. But unfortunately, then these individuals are left a little anxious because they'll call and say, the doctor wants me to start tomorrow. And sometimes that's really hard for us because we might not have an opening in our schedule for 7 days or 10 or 14 days, depending upon what's happening. And so the earlier we can get those things scheduled and laid out, the better it is for everybody. And so I would always rather get a phone call from someone who would like to set something up for a procedure they have in a couple weeks or a month, and then later on get a call, the doctor said, oh, based on the procedure, I need to delay that. Then the reverse of, ooh, I didn't set that up, and the doctor said it's really important I get in there. And that's always a big challenge for us because we want to help you out, we want to get you in, and we want to make sure you get what you need. But sometimes there's just not enough hours in the day, and I always feel really bad for that. So the biggest thing that you can do is talk to your care team, talk to your surgeon and their staff and everybody well ahead of time. When you schedule your surgical procedure, right, is generally the best time to figure out when you're going to schedule that first post-op PT visit, because you know when that surgery is going to be, and then if you communicate well with the doctor and they talk to you, then you can figure out when you're most likely going to need to do it. And then we can get you in, get you on the schedule. And the worst thing we'd ever have to do is cancel it, move it, delay it, but at least you're on the books and ready. So my biggest piece of advice is make sure you're set up for success by having that first visit after the surgery set up the minute you schedule that procedure. And we know sometimes there's emergency procedures, things pop up, and that gets really hard. But in order for the best possible scenario and the best outcomes, if you can set that up the minute you schedule your surgery, then that works best for everybody. That's what we have here. Any questions, definitely drop them below in the comments, but hopefully you found this helpful. Hopefully it answers some questions, and we'll see you back here real soon.